First of all, I'd like to start by saying that Vancouver is a very healthy city, and I'll get back to that in a moment. So I think really what we need to do is build on a lot of the strengths that we already have. But just to, first of all, talk about Vancouver Coastal Health for a moment, because we are the organization that delivers all the health services in this region. And in Canada, apart from in Ontario, all delivery of health services is now done by regional health authorities. So even though Andre Picard is concerned about the lack of mission statement from the federal government, we have a mission statement in Vancouver Coastal Health. It's called It's Healthy Lives and Healthy Communities. And what's important about that, it doesn't mention a sickness system, it doesn't mention an acute care hospital. We have goals and we have objectives. And one of our measurable objectives is to reduce the health inequities in the populations we serve. So this is your health authority, which is delivering a wide variety of acute, community, residential care services. That's one of our key objectives. We have a scorecard where we measure our progress and all our goals, and you may be interested to know two of the indicators we have on that scorecard. One is the Early Development Index, which is an index which measures readiness to learn for all 5-year-old children starting school in the province. Why would a health authority be interested in that index? It's because we know the importance of early childhood development. And we know that's important to prevent mental illness, addictions, and a host of other problems in the future. We may not be able to influence it as directly as other organizations, but we know it's an important measure of health. One of our other indicators is called the Disparity Life Expectancy Ratio. We are able to look at the life expectancy of geographic areas within the health authority. We call them local health areas. And we want to compare those. Andre Picard talked about differences in life expectancy within very small communities in some urban centers around the world. And we've had that in Vancouver. When I started working in public health in Vancouver 15 years ago, the downtown east side community health area had a life expectancy of only 69 years, which was more than 10 years different than neighboring communities. Now you may be interested to know, because people talk about the downtown east side, that the life expectancy in that community is almost 80 years. It's almost the provincial average. And we've been able to achieve that in a period of only about 15 years. And actually a lot of that change has come through the delivery of health services. It's been through some of the things the city has done. It's been by reducing overdose deaths in that community through Insight and other harm reduction programs. It's been through treating people with HIV/AIDS with our partners at the BC Centre of Excellence in HIV/AIDS and the Urban Health Strategy. And in fact, the lowest life expectancy in our health region is no longer the downtown east side. It's actually in the Central Coast, which is a remote part of the health authority, primarily populated by First Nations communities. And that's the area where we need to start focusing. But what that indicator allows us to do is to measure our progress. And we have been making progress, even in our very disadvantaged communities. Now, just to step back a bit, you've heard a lot about the history of cities, the history of public health. Before we regionalized about 16 years ago, public health was part of the municipal infrastructure. And in Ontario, in the city of Toronto, for example, public health is still part of the city infrastructure. And there's a reason why public health developed along with municipalities, and that's because of what we heard from Andre Picard and others, that in the 19th century, the primary causes of death were infectious diseases. Many of those were related to sanitation. So the improvements in sewage treatment, drinking water, and even housing that was often done by municipalities were some of the most important public health initiatives of that century. We now know, coming to the 21st century, that our most important causes of death are no longer those diseases. They're chronic diseases, cardiovascular disease, cancer. And it may not seem as obvious how municipalities can work to address those, but of course we can, and we've heard some of the ways today through things like a healthy built environment, an environment that encourages people to be physically active, a municipality that helps to reduce smoking rates and makes it easy for people to find healthy food. And in these regards, Vancouver is doing extremely well, and this is why I say we're already a healthy city. The province of British Columbia started a Healthy Communities Initiative, and they want municipalities to start looking at initiatives to increase physical activity, healthy eating, reduce smoking rates. We're leading the pack in that regard. And that's not thanks to only to people working in the healthcare system. In fact, I'd give less credit to the work we've done and more credit to what local government has done. So Vancouver already has probably the most walkable city in Canada. And that's because of the great urban planners, the great local governments that we've had over the years. You don't need public health telling you how to do urban planning in Vancouver. You already know how to to do it to create a healthy population. We have one of the lowest smoking rates in Canada, and we have probably the best smoking bylaws anywhere in North America. And those bylaws, and research has shown this, have reduced deaths from cardiovascular disease. They've lowered smoking rates. So we're doing great. Food security and healthy eating is an area where we may need to do more, but you've already heard about some of the things that are ongoing that the city, Vancouver Coastal Health, and others are working on. So if we're doing all that so well, what do we need to work on? And that's the question we really have today. Well, I think there's a couple of areas. First of all, and Trevor mentioned I was going to talk about this, health inequities. And many other speakers have already talked about this. Even the mayor talked about this. In fact, he could give my whole presentation, which is one of the great things about Vancouver. It makes my job easy that we have a mayor and council, city government that really gets it. But we can look at indicators of health of this population, and they're very good. That masks the fact that there are populations that don't enjoy the same good health. Health inequities are preventable. They're not health inequalities that occur due to our genetic makeup. There are things that we know that we can address if people have the same opportunities. So we know that people living in poverty suffer ill health. We know that immigrants and refugees, some of those groups don't enjoy the same good health as the rest of the population. Aboriginal people in BC, including our urban Aboriginal population, don't enjoy the same health. Those are the groups where we need to focus. The second thing we need to do that is to have good data. And Andre Picard mentioned this. And we actually have some pretty good data. The Vancouver Coastal Health, in conjunction with all the other large cities in Canada a few years ago, embarked upon a project with the Canadian Institute of Health Information. We divided up our cities into neighborhoods, and we were able to create, using something called a disparity index that was developed by our colleagues in Quebec that measures things like education level, social isolation. We divided up our neighborhoods on that disparity ratio and looked at some health indicators, use of the healthcare system for chronic disease, risk factors for chronic disease. And across every city in Canada, people living in so-called deprived neighborhoods have worse health. They're admitted to our hospitals far more often for chronic disease. They have higher rates of smoking. They're less likely to be physically active and eat healthy foods. So we now have the data that can point to the neighborhoods in Vancouver where we need to focus our efforts. And that's very important because one of the mistakes that we've made in public health over the years and some of the health promotion work we've done is to offer that to the entire population. And many of our messages, of course, get taken up by the people who are already healthier, better educated, have more means at their disposal. And we've been able to increase life expectancy at the high end. We've actually worsened that gap between those living in good health and those living in not so good health. So we have the data. We need to focus on those populations and neighborhoods that we know are a problem. And the final thing I want to say, because we haven't talked about it much yet this morning, is the focus on early childhood development, which, as I mentioned, is something that we are measuring in Vancouver Coastal Health. Why is that important? Well, because we know, and I'm a prevention doctor, so I like to always get back to this, that if we can develop children in early childhood, we're more likely to prevent the increasing number of cases of people living in mental illness, those with addictions, many of the chronic diseases that we face later in life. We need to start thinking of our children as a resource, and this goes back to a bit to Trevor's discussion of human capital. We need to invest in that resource just as we invest in other natural resources in this province. So it's not just those people who have children. This is important for the entire population. If we can focus on early childhood, we will allow our population to achieve their maximum potential. We will prevent many of those chronic illnesses in future, and we'll have a healthier population. So we need to continue all the good work we're doing. Our Greenest City Initiative, we could rename it our Greenest Healthiest City Initiative. It's already doing lots to increase physical activity, to address some of those determinants of health. But if we can focus on those populations that don't enjoy that good health, if we can focus on early childhood, I think we're really going to go far, and we're going to be even greater leaders in BC and Canada. Thank you.